In vitro fertilization. In this presentation, you'll find an explanation to what in vitro fertilization is, its intended uses, how it might benefit society, methods used in the developmental stages, as well as ethical issues. This number was recorded in 2015, and I would presume it's much higher to this day. But since 1987, there have been 1 million babies born in the United States as a result of IVF. IVF, in vitro fertilization, is the process of fertilization where the egg and sperm are combined outside of the body and then stimulated and monitored until being surgically placed back into the woman's uterus. This widely known reproductive technology has a number of intended uses surrounding issues with infertility, one of which would involve male infertility, where some men do struggle with low sperm counts or sperm motility. Women also struggle with blocked or damaged fallopian tubes, which would require surgical assistance for reproduction. And 1 in 4 infertile couples struggle with ovulation disorders, where the woman cannot get pregnant due to unstable ovulation schedules. IVF does have certain benefits to society, one being it provides solution to medical infertility, which is an emotionally and physically challenging situation to be in, and it can be very difficult for a couple or an individual to face and overcome. So having options and alternatives is important, and it can be very beneficial to many. Secondly, it provides opportunities for same-sex couples who are interested in expanding their families but are genetically unable to do so. It provides the opportunity to still carry a child while supporting equalities for genders and relationships across the board. IVF works through a combination of medicines and surgical procedures that help with the processes of getting an egg fertilized and then getting that egg implanted into the uterus. The basic steps of IVF throughout the process would involve the woman taking medicine to help her eggs generate at a much heightened speed, while the doctor would then collect the eggs and the man's sperm, mixing them in a lab setting, and then taking those eggs, once fertilized, placing them into the woman's uterus. Pregnancy will occur once at least one of the fertilized eggs gets implanted into the lining of the uterus. There is a possibility of IVF being successful in the first try. However, the average woman takes about 2.7 IVF cycles before successful conception. Many of these results are heavily contingent on the woman's well-being and age, because before the age of 30, a woman's eggs are mostly fit for reproduction. There's only 30% that would be considered to be chromosomally abnormal. However, that number gets even higher, with 60% of their eggs being considered abnormal and unfit for reproduction by the age of 40, and continues to decrease in possibility as time goes on. There are testing opportunities available for people who are interested in IVF, including pre-implantation genetic testing for aneuploidy, and it's used to test for embryo abnormalities prior to transferring them into the woman's uterus. The embryo's abnormal chromosomal results following this testing is highly likely to be successful and result in live birth. Here we see a chart from the Advanced Fertility Center of Chicago. Yes, these numbers are maybe a little skewed, as they are from 2014, 2015. And that was, about a half decade ago. But the basis of it still stands, as far as the women getting older and the possibility of reproducing gets even lower. Women get older and the possibility gets lower. Thank you. Possible side effects and risks associated with IVF would include cramping, bloating, infection, bruising, mood swings, miscarriage, ectopic pregnancy, and ethical issues. More in depth, the process here begins with a simple embryo transfer, which we tested, and then the diagnosis will point towards whether or not IVF is a possible route to take, and then the ovaries would be then stimulated, and the eggs would be then retrieved, as well as the sperm, and then fertilized in the lab. Some methods in development would include ovarian hyperstimulation, which is used to stimulate ovaries to increase the chance of pregnancy. However, this can go very bad, resulting in very swollen and painful ovaries. An ultrasound-guided transvaginal oocyte retrieval is an ultrasound probe inserted into the vagina, and it will go through the follicles within the vaginal canal. The needle will identify eggs that need to be retrieved. Then, once they are retrieved, as well as the sperm being collected, they will be co-incubated, meaning they'll be kept together during the incubation period. Certain ethical issues surrounding IVF would include high rate of multiple births. Because they are looking to be successful with IVF, and the embryo has a relatively low chance of survival, multiple embryos are transferred into the uterus to ensure successful results. The issue with this is the unusually high rates of multiple births, including twins and triplets that were not anticipated. The risk of multiple births in the process of natural reproduction is uncontrollable, may be equally surprising, but the deliberate placement of multiple embryos in hopes of one success is deemed unethical by some parties. Another ethical battle that exists here surrounds the concept of personhood and the death of a pre-embryo. During isolation, it is very common for the embryo to die, essentially. It would be destroyed. And many find an issue with that, saying there is a heartbeat, there it is a person, and it is a major ethical issue because they would take away their right to live had they gotten the chance. Lastly, there's possible wrong done to the offspring. There's always going to be a risk associated with developing technology. Many would even say, not many, but there are arguments on the basis of they did not ask to be here. And there's also the risk of transmitting serious disorders without prior knowledge. And there's testing that can rebuke that, all the steps taken and precautions that professionals emphasize heavily should negate any of these arguments, but they are very common, especially for those who support very religious beliefs, and they are very strong in their traditional ways. Thank you for listening.